Coming up on this Focus on Veterans Health special, we discuss the VA Healthcare Network's response to the COVID-19 outbreak with Vision 6 Director DeAnne Seekins. Hello and welcome to this Focus on Veterans Health. I'm Jeff Smith, the Director of Military and Veterans Affairs here at UNC-TV, and I'm pleased to be joined by the Vision 6 Director of Veterans Healthcare Network, Ms. DeAnne Seekins. Thank you so much for being here with us today, or joining us remotely, I guess, today.
Yes, thank you, Jeff.
Absolutely. First question is, with Vision 6 being over Virginia and North Carolina, how is the Vision holding up with this current COVID crisis?
We're doing well. Our staff are well prepared, trained, and I'm extremely proud of how we have positioned ourselves, readied ourselves. We've actually been able to send staff to work with New Orleans, New York, so we've been able to help other Vision partners.
That's very interesting. Are you learning stuff, because we didn't have a chance to really talk about this before, but are you learning stuff from these other Visions of how they're handling things or how things are happening with them? As you send people out to help them out, are they reporting back?
We're learning on many levels. Actually, as network directors, there's 18 of us. And so we meet daily with our senior leadership team. We're tracking this across the country. We're working together, looking at best practices, also lessons learned. And our staff, again, we have a very robust system when there's emergencies. Unfortunately, it's not usually an entire country that has emergency at the same time. Usually we help with hurricanes and things like that. So we have staff that are well trained to go in and assist, and they are learning. And so should we have any situations that arise like that, they're ready.
Yeah, just last year, the year before, you've had several hurricanes that have affected even the North Carolina and Virginia locations for your healthcare facilities. Those mobile hotspots you've had to bring up for those hurricanes. I guess it's similar how you're mobilizing the healthcare here, even at our location. Is that correct?
It's true. It is somewhat like a hurricane. And again, unfortunately, Network 6 has become very good at emergency management and emergency responses. A little bit differently here, though, is we had an opportunity to be very proactive. And so in the first part of March, we began screening all of our veterans and even their visitors when they came to any one of our sites. You know, we would ask some questions about, have you traveled out of country? Do you have a fever? Do you have a cough? And so if any of those triggered what I would call positive, then we would mask the patient or the visitor and get them to the clinic. And at that time, they could be truly screened at the next level. And by doing this, it really allowed us to, I think, prevent a lot of possible spread, because by ensuring that they were screened at the door or outside the door, then it didn't have someone who possibly was infected walking through an entire medical center or through an entire clinic and potentially, spreading the virus. And so that's been very effective for us.
Obviously, the whole network, the whole Vision here, it has more than just the hospitals. There are the hospitals, obviously, throughout the states of Virginia and North Carolina, but there's so many different levels of healthcare that the VA has available for veterans. Is this a universal style of how you're rolling out the recommendations for all the different facilities, or are there any kind of individuals, facilities that are getting something different that they need?
We did this universally. We have about 46 sites of care through North Carolina and through Virginia. We had the big stand up at the medical centers, and then we rolled this out to the community-based outpatient clinics. One of the things that we've also done is that we've minimized people coming into any of our sites of care. So we've made contact with all primary care patients, all specialty patients, and unless it's urgent or emergent, then we're providing care through telephone visits, through video connect, through secure messaging. We even set up in some of our sites, our main facilities, drive up pharmacies. So if you needed a prescription or you needed a refill, then we could fill that, you could drive up and we would actually deliver it to you to your car. We truly want to minimize the risk of any veterans having to, come out, get into the facility, get into other areas, community areas. And so that's been very successful.
I know recently in the last couple of years, the app has been rolled out for your telehealth, and that's been a very big success. And I guess the timing had just happened to be perfect that you already were up and running with a lot of your technology for this type of scenario.
You're absolutely correct. Because another thing that we did is, some of our providers and staff, we actually let them go home and work from home because they can use their app. They can do the appointment telephone to telephone with our patients. So not only are we ensuring veteran safety, we're doing our best to ensure employee safety as well. And so, you like to think that that something positive can come out of a bad situation. And I would tell you the positive curve to this is our comfort level by both our veterans and our staff to use this video connect has increased. And so our visits are increasing. So who knows, maybe after this is all over, we may see many more veterans who will ask and choose to have those video appointments.
What is, obviously, I'm guessing this would be the first line of defense for someone who does start to have some symptoms even this late in the game. If they start feeling ill, start having an issue, this the first step is to do the telehealth and then work your way in the system if that's possible.
Right, that can be one of the first steps. You're absolutely correct. So what I would encourage our veterans to do, if you start to feel that you're not feeling well, you have a temperature, you have a cough, anything, even if it's outside of possible COVID, if with your normal health conditions you're not feeling well, make contact with your facility. Either do it through secure messaging or through the telephone, and then we could set up a video connect appointment with you to give you that first level screening, possibly provide treatment. If you feel that you need to come to the medical center, you feel that it's urgent or emergent, we'll meet you at the door. We're meeting all of our veterans, we're screening, and then we will get you to the appropriate place. We even have tents set up at our sites where we're doing screening in your cars. So if you are not, you're just displaying some of the symptoms, but maybe don't need admission, we can screen you, we can swab you, and then send you home and ask you, stay home, stay in. We'll get your results to you, but please be quarantined and be considerate of everyone around you.
I know one of the big things that you and a lot of us have been talking about is please wash your hands. That's it, first line of defense.
Yes.
And for those people who are feeling some sort of symptoms, even if it's mild, because obviously right now we're in the South, we have the wonderful pollen season that's hitting heavy. Sinus issues are constantly happening, which creates coughs, creates some other issues that go along with it that are similar to the symptoms of COVID. Is it something that the veterans should, I hate to say ignore because they've had sinus issues all the time like I do, should you just ignore that cough, or should you just go ahead and say, hey, let's get this documented, this is happening, and we can monitor it and see where it goes?
Yeah, I would say make contact with your provider. If you use secure messaging, send them a message, let them know how you're feeling and what's going on with you. It's always good for you to keep in contact as a veteran with us. And we want to ensure that your health care is addressed. And right now it's very interesting times. And so we have so many means that you can get in contact with us. So please do that.
For those who have become sick, I know most people, we try to be able to see if they can be at home and self-quarantine and get well at home. But is the VISN having to see some hospitalizations from this illness currently and up to this point?
Yes, we have had veterans who have been hospitalized with COVID. We have had some that have had to go into the ICU, but we're seeing a recovery. We're seeing a recovery with many of these veterans as well. So the best thing is to seek that advice. And if you are in need of care in the inpatient setting, we have access, we have capability, and we have great physicians and nurses who are going to care for you.
I know historically VAs are not seeing civilians. That's not part of your mission typically, is to work with the civilians, to work with the veterans. Is this an unusual case where maybe not Vision 6, but other VA facilities are starting to kind of help out since there are shortages around the country. I know New York and New Jersey and some of the other hot spots, Detroit and New Orleans. Is there more of an opening up to kind of share the help that's out there with the VA network?
Yes, our fourth mission is the community. And so VA is in some areas partnering with the community where there is limited capability to have maybe enough beds. There's bed shortages in the community. Right now in North Carolina and Virginia, we have not had or experienced, fortunately, the surge that some of the other states have. So I can't speak for community, but we've not been asked at this time to take a mission on yet to provide civilian care.
I know one thing that civilians don't understand is that there is still partnerships. So with private hospitals, I know in Durham, Duke University Hospital, you're right next door to each other, and you work side by side sometimes with Duke physicians and the VA physicians on different situations. And I'm sure there's others in the other regions as well. How's that access and sharing of communication information, sharing of information, how is that helping this fight right now? And I know it's not new. This has been established to have that partnership.
Right. VA and community partners really are, connected. I mean, we have to. In a normal setting, 30% of our care is provided through community because we have such a strong partnership. So that would not go away in a crisis. We would still continue that connectivity. I have weekly calls with North Carolina healthcare, private sector, our medical centers, our directors there are also keeping very close contact with the affiliates. So we're keeping our finger on the pulse in both Virginia and North Carolina of what's going on in the community and how we can partner together. We're working very closely with our state veterans homes as well. As you know, the elderly population is a very vulnerable population. So we are across both states. We're having almost daily conversations with those folks. So this is one large network, and we will continue to work together. VA in North Carolina and Virginia, should we begin to see a large number of cases, then the fourth mission may kick in.
And I know there's been a lot of reports about shortages for equipment and everything else. At this time, are you guys okay on your equipment abilities and masks and everything else that's needed?
Right. Thank you for asking that. Personal protective equipment has been an issue on the news and everywhere. And yes, I will tell you, Vision 6, North Carolina, Virginia, we're very fortunate that we have a wonderful logistics system. So we monitor our supplies, our burn rate, how many supplies are being used across the network daily. We have the flexibility that I can shift supplies if needed. And we follow CDC guidelines. So every one of our sites of care has the appropriate equipment, the appropriate PPE to ensure that we follow those guidelines.
Currently in North Carolina and other states, I think Virginia as well, may have the stay-at-home order in place right now. And so we're trying to minimize the amount of people in public places. I know in North Carolina, especially in Boone and in Asheboro, we had the additional facilities inside the Walmarts that were available for the VA, for the veterans, your VA partnership. I'm guessing that's something we've slowed down now to try to prevent that spread as well in those locations.
You're correct. Since those were located in community areas and we're trying to keep people at home, we have stopped those services right now, and we've gone much more to the video connect and to the telephone. And so we really want to keep folks safe. And that's how we're going to stop this spread, is by staying home.
Now, if you're not COVID issues and you do have something come up, I know I have family members who use the veteran services and they need to have blood screenings and everything else still on a regular basis due to their service. Those things are still happening is when it's safe, right?
Correct. Our hospitals are still fully open. What we have done is decompressed, and that means patients who are non-urgent, non-emergent, that can be managed at home, that's what we're doing. If you have blood draws, if you're being treated for a condition that we need to see you more often, no, those services are continuing. And your team, as a veteran, your team will work very closely with you. If they can do a blood draw, say every 2 weeks versus once a week, they're gonna make those adjustments. So they're gonna do everything they can to make sure that you're safe.
The secondary part of this is mental health.
Yes.
It's not just those who are sick that are having to think about everything going on around them, but it's also the people who are staying at home that might not be getting some of the outreach they normally are getting and help they usually get with being surrounded by friends and people who can help them out. What are some of the ways the VA system is trying to work to help people who are having mental health issues, not even suicide issues, but just the mental health side of things first?
Right. We have a wonderful group of chiefs of psychiatry and mental health psychology. And so what they're doing is they're working with all of their physicians, their therapists, their social workers to ensure that we're staying in constant contact with those veterans. So if it's someone who needs and has, been seeing us maybe once a week, they're ensuring that they get that telephone visit, that VTEL or video connect visit. So we're keeping in very close contact. Our services have not halted at all. And if it's someone who is in crisis and needs to be seen, we're seeing them.
So still at the facility, just like normal?
Yes, if anyone is in crisis, please reach out to us. We are seeing you and we will see you.
And is that, I know here in a lot of other locations, the vet centers, which is a side part of the VA health system, is that also still fully in effect, the vet centers, and they're getting the outreach they can get?
I really can't speak to the vet centers specifically, Jeff. They don't fall under my realm. I do know that, another group of very caring people linked very closely with our psychologists, psychiatrists, therapists. So if there are any patients that they needed to hand off, that would occur.
Yeah, everybody's partners here is all
It
the
is.
team. What are some of the other ways that you guys are prepared for it? This continues on. We don't know when this is really going to end yet. How do we go about the long range plan for this to make sure that we continue to serve everyone that needs to be served, at least in the VISN?
Right. And, the thing is, first of all, stay calm. And, wash your hands. We talked about that over and over again. And people are probably like, oh my gosh, I'm washing my hands 15 times a day. Do it. Continue to do that. For the long haul, like I said, we've really seen a swift move up in video connect visits. So we will keep our patients connected to us. Medications, refills, all of those will continue to happen. We're monitoring. So we're to me, we have this great fortune on our side because we are a regional healthcare system. So if one system were to experience more cases, we have another system within our region that can step in. I had mentioned this previously, but we've been able to send employees out to other networks, to New York, to New Orleans, because we have so much experience with emergency preparedness. And so we've sent folks into these hard hit areas from our network. And so they're coming back more experienced. They're coming back with even additional ideas because this is new for all of us.
And I'm sure some mental fatigue for your providers is part of the concern always. I mean, it's got to be part of that concern. I'm sure there's things in place to kind of keep the rotation going, keep people have at least some sort of rest that they can, and decompression as much as possible, even though, there's no end in sight yet. Hopefully there will be soon, but until there is, is that something you guys are already addressing with your physicians, your nurses, and all the other staff?
We are. We're actually, there's a couple of things we're doing. First of all, one of the things is we're offering services. If any of our employees, are feeling stressed or just need to decompress, we have people available that they can talk with. Sometimes you just need to talk it through. And then the other thing is that for our clinics, many of our clinics, as I mentioned previously, have been, I don't want to say closed, it's not really closed. We're treating the veterans in their home, but their duties have changed. So we're retooling and retraining some of those staff. So it may be a primary care nurse who now is learning how to be a med-surg nurse so that we can give relief to our staff who are in those areas should we get hard hit and need to rotate staff around. We want to ensure that they have the appropriate training.
And I know another concern that's going around the public is the lack of testing capabilities. That's it is a concern always that there's a limitation of how much is available, but you guys, if someone needs testing, the VA is doing the testing when it's necessary, correct?
That's correct. And Vision 6 now, we have one of our centralized testing units that we are providing testing, running the results for 3 shifts, and we're doing that for our entire network. Plus we have kits at each site, so they too can run them and have 24-hour turnaround time.
So 24 hours is pretty quick. That's a good turnaround.
It is, and we've definitely come a long way with the testing, the availability. Again, I'm so proud of our staff because we ramped up, we retrained, we had new equipment, and we've been able to get that up to 3 tours.
You may not be able to answer this, and this is okay if you can't. With the concern I have with our Vietnam veterans who are now in that advanced age level where they're in the vulnerable age group now, according to the CDC guidelines, and then you add anything else they were exposed to during their service, the Agent Orange exposure that's in the past. Is there anything that you do know of that that needs to be looked at for this, or is there any extra precautions you guys are having to look for, or that veterans need to look for to just stay healthy during this time? And are they at a higher risk, I guess is a better way of saying that?
Well, since I'm married to a Vietnam veteran, I remind him every day that he is in that age range where we definitely are saying that, or seeing that it's a higher risk. So what I would say to all of our veterans and our Vietnam veterans, which many of them are 65 or older, is take care of yourself and make sure if anything changes that you contact us. Don't just assume that it's because I'm whatever age and this is happening to us. Contact us and let us walk you through what maybe your symptoms are.
Wonderful. I appreciate all of your time, and I know you're busy right now. We're trying to make sure everybody stays as healthy as possible in the VISN, and I appreciate you spending this time today with us. And is there anything else that you think that our veterans need to know, or even our civilians that are watching this at home that might have a veteran family member?
Yeah, Jeff, first of all, I really, truly thank you for allowing me to come on your show. You know how I deeply care for our veterans, and we've had interviews before. So really having this opportunity to speak with our veterans or family members of veterans is that we're there. I mean, the VA system is solid. We're a healthcare system that has been in place since 1930s. And so we have the highest trained physicians, affiliations, nursing staff that are so dedicated. That thank you for trusting us, and this is a time that we need you to contact us if you need us, and so we're there for you. I really appreciate it, Jeff. Thank you.